mentioned, my name is Libby Sagara. I'm with Blue Path Health, and I work with eConsult coalitions across California. In addition, facilitate the eConsult work group, which you can find at econsultworkgroup.com, and we'll talk a little bit about that later, where you may be able to find our resources. So we'll just provide a little bit of background on eConsult, a quick overview of what eConsult is, and then we'll hear from our presenters, Dr. Karla Au Yeung from Valley Children's and Dr. Dan Wilensky from ConferMED. So with that, I just have to go through the quick administrative details here. This is a quick disclosure. We're really happy to work with Weitzman Institute, who provides the continuing medical education that comes along with this course. If you're on today and you are not a provider, that's fine. We're happy to have you too. If you are a clinician and you are interested in receiving CME for this course, you'll complete the survey at the end of this session, and you will get your CME from Weitzman Institute. So just a quick disclosure that our presenters do not have any conflicts, and we, as I just mentioned, we appreciate CME support through Weitzman Institute. Although this presentation is geared toward providers, we welcome questions from anyone who's on today. And you'll get a CME certificate at the end of this session. So with that, just wanted to give a quick overview. If anyone is new to eConsult, I think a good number of you on the call today have probably participated in eConsults or involved in your organization's eConsult program. We who help with eConsult growth across California and across the country want to be able to explain eConsult in a really simple way. This is a provider and patient tool that you see right now. Just a way to speak about eConsult in a very simple way. eConsult is asynchronous communication between primary care providers and specialists, as most of you know, but sometimes that's a little bit harder for patients to understand. So this is just a quick snapshot for patients to better understand that this is communication between a primary care provider and a specialist who is remote. This is hopefully a tool to help a patient get advice, specialty advice, without having to travel to another appointment. So increasing convenience for patients, making sure that when they see that specialist, it's appropriate and it's needed. So we're seeing this be an effective tool to better understand eConsult, and we're happy to share that with you. So I'm glad to see everyone is in from the waiting room, and I'm going to hand this off to our first presenter, who is from Valley Children's. I believe we have Dr. Karla Au Yeung on. Thank you, doctor, for joining us today. Dr. Au Yeung is Medical Director of Pediatric GI at Valley Children's. And in addition, we have Randy Guerrero from Valley Children's. So Randy and Dr. Au Yeung, I'll hand it off to you. And please just let me know when to click to the next slide. So Dr. Au Yeung, I'll have you take yourself off mute.
Yeah, thanks. Oh, sorry, I'm Karla Au Yeung. I'm one of the GI doctors. I'm the medical director at Valley Children's for Pediatric Gastroenterology. And we have a little bit of experience already with eConsult, which we hope is helpful for people. And so I was excited to be able to present today and answer any questions if that's an option. Valley Children's is, as you probably all know, we are, I think, about 328 beds is what they say now. And we have physicians kind of across the valley, even though the bulk of us are here, but we also, all of our doctors, no matter kind of where they are, travel throughout the valley. And we have a few who are stationed, one in Modesto, one in Bakersfield currently, and then our nurse practitioner in Visalia. And then many of us travel to all of the other places, including Merced, San Luis Obispo right now. And as a result, we saw, I think, almost 20,000 patients last year just for pediatric gastroenterology. Valley Children's, as you can see here, it's nonprofit. It's a pediatric hospital governed by the community leaders from across Central California. And that was how it was conceived from the very beginning by the first 5 women who had the idea to start a children's hospital in the Valley. It's full service. We have pediatric specialty care, plus a network of primary care providers. And our specialty care is even becoming more specialized. As you know, pediatric medicine is getting more special every year, it seems like, as far as the different specialists. 1.3 million children are in our service area, and we cover from what I know, Los Angeles to Sacramento and out to the coast. And then we have 330 bed main hospital campus in Madera, plus the 3 satellite NICUs. And we also, as I mentioned, have clinic in currently Bakersfield, Visalia, Merced, Modesto, and then on the coast in San Luis Obispo currently. So next slide. We also have a pediatric residency program in partnership with the Stanford University School of Medicine, and that's been going on. I think we're in our 5th year now. They're graduating the 3rd class, and that has been a real bonus as we've been able to recruit medical students to residency, then stay here to work in our system, and that has become a really great opportunity to expand our base of primary care, as well as a few doctors too, in fact, who are going to be GI doctors, one going to Stanford and one going to UCLA for their fellowships. Sorry, I had to bring that up. This is the map of the different areas where we're covering. And Randy, if you want to add any more information related to this map.
This is essentially just displaying the various services and our catchment area in the 11-county region, and some of the specialty care centers that Dr. Au Yeung referenced, as well as our NICUs, the location of our NICUs, and some of the other services. But just wanted to give you an idea of our scope utilizing this map.
And I think that I can just add to the reason why eConsult was very interesting to us. So I told you we have doctors kind of all over the valley, but we get between 500 and 900 consults per month. We're not going to be able to give all the patients the best care with that type of number. And so that's why we hope the eConsult will be a nice extra avenue. Sometimes when you have patients where you don't want to delay their care, and we can offer some advice on how you can get started. We share with you the commitment to care for kids here at Valley Children's in your organization, in our communities, and in our schools. Our best chance for the healthy children is working together. And I think we all firmly do believe that and try our best to make it so. For the eConsults, we have 7 pediatric subspecialties and over 40 subspecialty providers supporting ConferMED panel. Right now, it's neurology, cardiology, endocrine, gastroenterology, infectious disease, rheumatology, and genetics. So far, we've finished 90 eConsults since mid-November 2021. Most utilized are the endocrine, GI, neurology, and cardiology consults. Over 45 requesting providers from 4 FQHCs have participated so far.
Thank you so much, Dr. Au Yeung. Really helpful background, and you actually gave a nice transition there, since we're going to hand off to Dr. Daniel Wilensky, who is with ConferMED, the specialty network that is supporting eConsults across the Central Valley and many other counties across California and across the country. In addition, Dr. Wilensky is very familiar with what happens and where eConsult was probably founded or started, is Community Health Centers, Inc. out in Connecticut. So Dr. Wilensky, I'll let you give a little background on yourself and CHC, and thank you. Go ahead.
Sure. Thanks so much, Libby. Thanks to everybody for your attention. I'm not here alone. I'm here with Michelle, Rachel, and I've even brought 2 Mary Anns, and they all have better knowledge of the ins and outs of our of the back and forth of our eConsults. I'm more here for the clinical aspects. I'm a family doctor. I'm the medical director of ConferMED. So you see Community Health Center Incorporated here. That is, I'm a provider, and I see patients through CHC Incorporated. We're the largest CHC in Connecticut. We've created the Weitzman Center for Excellence, and part of what that is bringing technology to bear on primary care. And out of that, we have done a bunch of research on eConsults and how eConsults can be used in FQHCs where patients have a lot of obstacles. And out of that research, we have created ConferMED, which is the company that provides your eConsults. So we have, CHC has a staff of about 1,000. We've got 145,000 patients. We're about to celebrate our 50th year, and we are the largest FQHC in the state of Connecticut. essentially, we try to be as full spectrum as possible. And our goal, really what we're trying to do is be specialists in whatever our patients and our communities need. We have adult medicine, pediatrics, behavioral health, dental, nutrition, and more. We try to have as much as possible within our four walls, because once our patients leave our four walls, we lose some of the ability to help them manage, especially the uninsured and the underinsured and the people with difficulties engaging with the community. Essentially, our overall goal is to improve the health outcomes for our patients and build healthy communities, all through sort of the patient-centered medical home, where we build the care around the patient. I was just talking about our four walls, but I have sort of shifted my discussion to say our four virtual walls, because anything that we do, ourselves through the internet, we're able to control it a whole lot better. You want to go on to the next slide? All righty. Oh, okay, this one. So this is essentially an example of how an e-consult workflow may work. We work with each individual client to figure out what is the best workflow for them. Typically, what we try to do is we try to keep their specialty workflow the same, their referral workflow the same for e-consults as it is for their regular referral. But it doesn't have to be. There might be a better way of doing it, and we can help with that. So essentially, the patient might present to the clinic and see the primary care provider or one of the providers, and the PCP might decide, I have a need for an electronic consultation, either some information or a second set of eyes, maybe a little bit of education, and then sends it along. The referral team determines whether it can be sent as an e-consult. Of course, if there is no e-consultant for that field, or if it can't be billed, or there may be reasons why it can't go through, and they will then put it through. And then ConferMED will, or in general, it will be sent to the specialist, who will respond to it, and then it will come back to the medical center, the clinic, and the PCP or the primary care team will decide based on that whether the patient needs to be referred out, whether there are any recommendations that need to be done. The PCP would place any particular orders that are appropriate. You want to step? Oh, what did I do? Hold on. There we are. Sorry about that. All righty. And so the best situation, of course, is when everything is through your electronic health record, and that's how I imagine you all place your referrals. You place your referral in the EHR, and you look at your referral in the EHR. And that is typically how it works. But it doesn't have to be. You can go by fax. It can go by peer-to-peer. It can, our staff and the staff of any e-consult company would be able to help, help with the communication, details of software and all. Why don't we go to the next slide? All righty. So our staff typically will be the ones who compile information to send to the specialists, but of course a lot of it will come from your medical records department. It all depends on the individual relationship that is worked out when you set up the e-consults. You want to move to the next slide? Very good. And so we won't go through this, of course. First of all, this is a sort of a pediatric conversation. This is an adult patient, but this is just an example of what an e-consult might look like. On the top left, you see this primary care provider saying, I've got a patient with hyperthyroidism and seems to have some thyroid tenderness, with the question being, I need to know what steps for evaluation and treatment. So laying out the question as, I need to know what to do next, okay? And then the specialist responds, seems like a postpartum thyroiditis, and then goes through sort of a brief discussion of the problem, further testing that might be needed, treatment that might be considered, and then a comment on whether a face-to-face referral is indicated at this time. And in this case, not this time, but generally, if the specialist were to say a face-to-face visit is needed, typically they should tell you what the reasoning is, and also go ahead and provide some education, and with one of the goals being that the next time you have the same exact case, you won't need an e-consult because you'll know what to do. Why don't we go on to the next slide? So we're going to talk about asking a good e-consult question, because this is the same but different as getting a consult, right? And before I talk about this, I will, when I talk to the specialists, and when we bring the specialists on, we talk to them about what makes a good e-consult. And what we always say is, you may not get good questions all the time. You may just get rheumatoid arthritis, to a rheumatologist. And please give them as good an answer as you can. So that would include education. It would include your approach to things. So if you ask a very general question, you should still get a good answer back, but it's going to be general. If you want a specific answer as to exactly what to do for your patient, the more specific you can be, the better. Now, of course, we're all used to quickly deciding that someone needs to see a specialist and then just saying, okay, you're going to see GI for stomach pain, go ahead. And then we place the referral. I'm sorry, I should have put myself on do not disturb. People are messaging me even though it's my day off. All righty. So anyway, we were talking about placing a good e-consult. And so the primary care provider has to think about what the specialist what information might be needed so that they could give us the best advice, right? So we're used to not being good at asking for consults. We were all taught in our training, ask a good consult question, but if you're anything like me, your e-consult question might not be that good, because that the specialist is going to get the history, examine the patient, order some labs, and make their own assessment. This is different. You are keeping the responsibility, so you're really going to want to lay it out for the specialist, let them know what you're looking for, okay? And then be as clear as possible, weigh in, ask them, I need to know whether a referral is necessary. You might want to very clearly discuss what your patient's obstacles are to care. Maybe they have no insurance, maybe there's a lack of transportation, maybe they don't trust anybody but you. Any of you have patients like that who would rather me, do their open heart surgery than see somebody else. But anyway, if there are obstacles, lay it out. If you've got a case that seems like lupus and you would love to have a rheumatologist take care of the patient, but you also know that this patient is never going to travel the 300 miles and pay out of pocket to see a rheumatologist, you say up front, I need to know what to do next for this patient, and please walk me through it. I always say to everybody, all the answers don't have to come in the first e-consult. You can, go get the labs that are recommended, start the starting medicine that's recommended, and then repeat another e-consult and say, where do I go from here? So maybe you want to start managing a condition that up until now you felt a little bit uncomfortable managing. Tell them that. I should stop and say that I'm as a quality reviewer for these. I've in addition to asking for lots of e-consults myself as a clinician, I see it on that end, but I also have reviewed over 1,000, probably thousands of e-consults for quality, and we have a very careful review process. So I see, yes, please ask any questions you want to. So anyway, I'm sorry. I've looked at so many of these from the specialists, and there are times when someone will have a case of hepatitis C, and the gastroenterologist will say needs to see a gastroenterologist. I said, well, really, is that the case? Because I manage Hep C, and lots of primary care providers manage Hep C. So if there's something that you want to start managing, let them know and ask them to walk you through it. The more you let them know, the better. Let's go on to the next slide because I'm rambling. I want to give everybody a chance. So I don't really want to read all this. Let me give you about 30 seconds to read some examples of some good questions. on the second, under pediatric endocrinology, I'd probably ignore sort of the second case because that's not, it's a little bit, I think it's out of context. But just take a look at what people are asking. Good. And, the focus is, what do I need to know from the specialist? Let me ask for it. And what does the specialist need to know to be as specific as possible? And so we can't, so these are examples, but every patient's going to be different. And of course, there's going to be some routine stuff that automatically goes. Your last progress note, maybe your last 2 or 3 progress notes, depending on how you've set up, all the labs probably from the last year. But let's say if you're sending someone off to an orthopedist and you have an MRI from a year and a half ago, well, the person in your medical records who's putting things together is not likely to grab an MRI from a year and a half ago. So if you want that included, just say it right there. Sending to orthopedics, tell me what to do with the shoulder. Please include the MRI from July 2019. Let's move on to the next slide. And once again, I'm going to give you about 20 seconds just to look through these. You don't need me to read them to you. All righty, and I think we have another slide or two. Great. Oh, so that's the end of my slides for right now.
Dr. Wilensky, before we hand off to Dr. Au Yeung, just a quick question for you. I'm going to go back to your slide. Do you see, when you see questions like this, is there sort of a common follow-up next question that you would have for the primary care provider, like for additional information? You're missing this lab, you're missing this image. Is there any sort of basic level of information that you would recommend be included in that first question?
So now remember, of course, the labs are going to be attached to this.
Yes.
So ideally, looking at this question, if I were the provider, I might indicate, please include labs as far back as such and such. So here the question is, do you recommend any further workup of evaluation? And if so, what? If the workup's not recommending, how do we follow this? And if so, how frequently? These are some great questions. Now, of course, if the specialist says, oh my gosh, it could go one of 2 ways, and the question, you probably know what the person's bilirubin is, but I don't see it, or something like that. They might quickly ask you a follow-up question through our back and forth on the website. In which case you can quickly provide that information and then they could respond. But typically they're going to take the information given and come up with the most thorough, specific response and a set of recommendations as possible. And then if that doesn't seem, if it seems like the specialist didn't quite get what you were meaning, or they missed out on a piece of information that might not have been sent, you can quickly communicate with them through our website and say, I'm sorry, it seems like you didn't answer my second question, or something like that. But typically what will happen is, after you have gone through following the recommendations, you will hopefully have a conclusion. And if you don't, then you decide what you're going to do. Are you going to get another electronic consultation with the same specialist? Are you going to send for a face-to-face? Is it something outside of this specialty? Is this something that you can have an ongoing, you can manage in an ongoing way? So just being as specific as possible. If you get an email saying that you have a question from the specialist, look at it and respond, because they might be holding off on giving you a full response until you give them that one little bit of information. Now, if they look at the case and say, well, really there's 5 different parts of the physical that need to be done, and several different labs, and there's some history items that I want you to get. I talk to the specialists about, in a very kind way, express to the primary care provider, these are the things I'm looking for, and this is why I'm looking for them. And so if you're able to bring the patient back, these are the pieces of information that would help me be able to give you a more specific e-consult. And in the meantime, here's a review article. Here is how I approach this in general. That's, did I answer the question?
Yeah, that's very helpful.
Okay.
Thanks for the detail
Sure,
on it.
sure. Mhm.
And with that, we're going to hand to Dr. Au Yeung, who's going to speak to some cases that she has seen and participated in. So go ahead.
Yeah. And just to piggyback on what you just mentioned, I would say the website is very user-friendly for us. All the information that we have really helps because we sometimes get calls from people and we have no way to document it. So we can't track to see what happened and we don't have the actual medical record. So I will say from my perspective, that's been a very nice added benefit. So this is and actually you said many of the things that I would have said as far as how I approach the consults. They're variable. Some of them are abdominal pain, please help. And others are, pretty straightforward. Like this person has reflux. We've tried this medication and this medication hasn't helped. Is there anything else I need to do before sending to you? And I think that's very helpful too, because sometimes we do need to do an endoscopy, but if we know up front all the other workup was done, it saves the patient a visit, at least one visit. So I do like to document in my note this particular complaint was chronic gastritis. And I think in this instance, gastritis was the presumptive diagnosis based on the clinical signs and symptoms rather than endoscopy or some other modality. So I like to document that I reviewed the records that were sent, partly for my benefit later if I look at things, because this one patient actually had records at Valley Children's too, so everyone knew what I was reviewing as what and what information I used to get to my assessment and plan recommendations. So in this instance, I was able to identify that another doctor had seen the patient with a specific concern that, from what I could tell from the chart at least, had already been ruled out as a complicating factor. And then I usually like to do an assessment and plan, and I like to use bullet statements in this setting, whereas in my notes, I might give like a big differential diagnosis and more in-depth information. I would assume, I've been a general pediatrician, so I would assume primary care doctors need us to be a little more direct in their busy day. So in this instance, I wrote her pain seems nonspecific and low grade, and I felt that was important because maybe I had misinterpreted something. So I tried to be very obvious about what I was interpreting and what the most likely components of the differential diagnosis included and what labs I would start out with, and trial of medication and dietary, as well as any behavioral things. I go to Merced. So in this instance, I think the patient, I probably was able to identify they were from the North Valley. So I wrote to follow up in our clinic there if things were not either helping or obvious based on those results. Does anybody have any questions about that or comments as far as how you, would this be a helpful consult, I guess, would be one question I would have. What kind of feedback I could get from you all in this, kind of chronic, common problem I'm sure you guys see frequently.
You can just take a minute. If you'd like to take yourself off mute, you're welcome to ask a question.
So I guess since I review all of these e-consults for quality, I would say this is a terrific response. It's it's clearly answering the question. It is organized. The advice can be followed very, very clearly. And there are contingency recommendations, which I love to see. So it's not just do this, it's like do this and consider this if, so we like to see the contingency suggestions because that can carry the primary care out farther in terms of the workup and treatment.
And we do welcome people to consult us back, as you mentioned. That's fine. And well, maybe I'll move on to the next one.
Sure.
As people are
and from our point of view, let me just say that from our point of view, we will always try to get the second e-consult back to the same person if at all possible.
Oh, that's good to know. That's good to know. And then this one was a 14-year-old with persistent nausea, abdominal pain intermittently, and they use pantoprazole, increased dosages. Please evaluate and give recommendation. Basic labs are normal. So I must have been able to review the labs. So this is an example of labs being available. I felt like just my perspective on the PCP's information gave me a clear idea of where they'd like me to go with my my response. And I think it's a pretty general question, but my sense is they needed a general answer, so I went for it. And again, just kind of reviewed the medical records, and then I like to restate my interpretation of what they're asking so that I am not, just to close the loop, make sure we're both on the same page. And in this one, I also included the things that I agreed with. And then I think I wrote, I did not read about any abnormalities of the stool pattern or color of blood. I just meant there that I didn't see anybody document it. And so that was something I couldn't really identify to follow through on as far as my recommendations. So maybe I could have stated that a little clearer as I'm reading it now. And then I didn't see any documentation of systemic symptoms such as fever, joint pain, or rash. So again, I think if person who received this, maybe the next time they send me a consult, they'll know the kind of regular things I ask about when I have a patient with kind of a general symptoms like abdominal pain and nausea. I'm looking for red flag symptoms too. And then I recommended the following: discuss possible stress with patient, check same labs as before, so people will start to get an idea of the way we look at this problem. Stool H. pylori, you can see all the things there. And I also included an abdominal ultrasound, and since the symptom was kind of vague, and if they found abnormalities, referring to pediatric surgery. I expect this patient will need an upper endoscopy with biopsies, and hopefully that was helpful to let them know if these other tests came back negative to go ahead and get a consult out to us. And so any feedback related to that would be great.
This is a question for both Dr. Au Yeung and Dr. Wilensky. If you have a detailed set of recommendations like this, do you have any suggestions for how to explain to the primary care provider how they might explain this to the patient? Do you have any suggestions how to get this information back to the patient verbally, or let them know what happened?
That's such a great question, Libby. I guess that the first thing I would say is that when a specialist asks for a bunch of tests and doesn't explain why they're doing it, then that is really setting the primary care provider up for failure and for difficulty with communication, because they are now ordering things. They don't even know why they're ordering them. So we encourage our specialists to provide education to the primary care providers, real education, so that they can learn and grow. But the minimum amount of education that we think is acceptable is to at least provide the reasoning, with what you're asking for. Now, of course, a lot of the things are obvious, but it's important for the specialist not to think that primary care providers know, particular primary care provider knows more than they might. So they do need to help us know why we are doing things. In terms of speaking to the patient about it, I think we in primary care we are really experts in communication, and we can handle how to do the going back and forth. I don't think the specialist needs to tell us how to communicate with the patient, but just to explain to us why they're placing their recommendations, and ideally talking about, as I mentioned earlier, the contingency recommendations, because if we say to the patient, so we're going to get these 12 different labs, and then the patient says, why? And like, well, that's what they wanted, and this is to rule out this. It's like, well, what happens if it's abnormal? We might not know the answer to that. And so the more of a picture that the specialist can paint for us, the better, because we are the ones who are explaining this to the patient, or in a lot of ways, our nurses are.
Mhm.
And Dr. Au Yeung, I want to compliment this consult. I'm not a clinician, but as I read this, you did that very well. You did say this is why. so thanks for that great example. But do you have anything to add there?
No, but as you're talking, I'm realizing I probably should say, because for instance, to your point, if we do have a positive tissue transcontaminase in children, I don't know if it's the same in adults, we would do an endoscopy in that setting. And I realized I didn't put that on there. Pediatricians kind of know that, but I'm not sure all primary care providers do. So anyway, thanks for teaching me while we're here.
Sure. And one of the other things I do try to speak to the specialists about is, if there's any way, as you're reading through the progress notes and the clinical question, if there's any way to gauge, what level for this particular question, what level this primary care provider is, providing the education and the recommendations to that level.
Yeah, that's a good point. I do think we did receive feedback already. I don't know if this helps other people in the audience, but I think the feedback we receive is very helpful and it comes extremely timely. So we try to improve as we go based on that. That's
great. I welcome any additional questions for Dr. Au Yeung and Dr. Wilensky. Please take a moment and use the chat if you wish. Before I move on to the next slide, anything else you wanted to add, Dr. Au Yeung? No, I'm sorry, I'm on call, so I got paged. I apologize. Oh, no worries. I'm good. I think this leads into some of the points here. I don't know if Dr. Wilensky, you just want to talk about how you wrap things up.
So wrapping things up, and this is also about talking to this slide is about talking to the patients, as we talked about before. So essentially, I introduce the idea of an e-consult with the patient and say, I have somebody who can weigh in on this, a specialist and a dermatologist who can look at these photos, a pulmonologist who within a couple of days is going to be able to give me some good advice to just make sure we're on the same point. And I'm going to have my nurse call you typically within a week, definitely within a week and a half, to let you know what the next steps are. For example, on Monday, I saw somebody who had this rash and I was like, I think I need to biopsy this. But hey, maybe a dermatologist will just look at it and know what it is. And so today I got the response back saying, could be one of 5 different things I would biopsy. And so I sent it off to my nurse to call the patient and schedule them so that I could biopsy it. And then when the biopsy comes back, if I don't know what to do, I can attach the pathology and send a new e-consult to the same dermatologist and get some follow-up advice. But essentially, you don't want to really spring this on the patients. The patient should know that you are seeking out advice from a specialist and you're making it easier on them. I'll say to somebody, look, you probably actually don't need a rheumatologist. I'm not sure. But even if I could send you to a rheumatologist, there's probably a 2 or 3 month waiting list. And how about I have my nurse call you within a week or week and a half and let you know what a dermatologist thinks of all of this information. I'll make sure that they have access to everything that I have about this situation. Most patients are very, very pleased with it. And the patients who say, no, I demand that I need to see a cardiologist or whatever, then, we face that kind of thing. And then you make your decisions, not necessarily on clinical issues, but based on your relationship with the patient and your feeling about unnecessary consults.
Thanks so much.
Sure.
Please do share any questions. We'll just take a moment here to those who are in the audience. Some of you are in a position where you can speak. Some of you would like to share via chat. Either way is fine. Just a follow-up comment both of you touched upon was the distance patients have to travel to receive specialty care. So Dr. Au Yeung is sitting in the Central Valley. For those of you who are not in California, the distance to travel could be 3 hours to get a specialty visit if it's a very specific specialty need. I'm sure that you have similar travel challenges, Dr. Wilensky, in Connecticut, although it might just be travel, crowded freeways, but we do see that this does help to reduce patients taking time off work and travel. Have you seen any cases where a patient's need was resolved without having to have that kind of specialty travel? And I'll put that on Dr. Au Yeung, since you're probably familiar with what patients are facing in Central Valley.
Well, I don't think I actually saw those patients, so I'm assuming everything turned out okay, but you make a good point. I don't know if we need a different type of follow-up from our end to make sure that it all worked out. And honestly, especially lately with the way the gas is, but if you don't have transportation, it's probably the same if you're a half an hour or 3 hours. So yeah, I think personally, I love this. I think it's wonderful because hopefully we're educating people on some of the very, basic things we would do anyway. And I think I totally agree with the doctor that the patients love their primary care providers and already have that alliance and know that they have their best interests at heart. You could tell that even when you do see them as specialists. So I would assume it's excellent for them in that setting. And plus, what I get a sense of, if people go to a specialist, it actually creates a new level of anxiety sometimes that they don't really need to have. But their primary care being able to take care of them right there, I think alleviates that too.
That's a great point, Dr. Au Yeung. Thank you. And with so many languages being spoken, if a patient has that relationship with their primary care provider where they can speak in their own language, it's so important too. Just taking a pause here. If anyone has a question, they're welcome to take themselves off mute.
Great. And I'd like to follow up on that real quickly. That was really a lot of good points there, Dr. Au Yeung. I would say don't worry about the follow-up. That is not, the relationship of the e-consult is a completely different animal than you being a specialist. You are talking to the primary care provider. You do not have a patient provider relationship with the patient. So this is all turning it back to the primary care provider and assuming that the primary care provider is comfortable continuing to manage without an in-person specialist, then they can continue to do so. And we have the data. We know that about 75 or 80% of the e-consults that we receive are resolved as PCP management. And so that means about 25 or 30% of the cases, the specialist will say, this person should have a face-to-face visit with a specialist. But that doesn't mean that e-consult wasn't necessary or unhelpful, because, I mean, someone shows up in your office, they don't know why they're there. You don't have any of the information, or you have all the information and it's not what you would have wanted. So you get started, you order some labs, and then you say, okay, drive your 3 hours again next week and we'll talk about the results. When the patient shows up in your office after an e-consult, where you have said, I would do A, B, and C, and then they can be seen in my office, and if there's anything abnormal, we'll see them in the office. Then by the time they get to you, you are not wasting that first visit. So it's making the travel, making the time taken off work, making everything much more valuable. When done right, by the way, not every e-consult is perfect, right? And so I already mentioned that we have a really good quality approach. We review the first 5 for every specialist. We review e-consults of their every month, and we give them feedback for any issues, and then we give them feedback regardless twice a year. But if you have a complaint, our complaint process is really rigorous, and it helps us provide better e-consults for you. So if something doesn't fit, if they don't answer your questions, if they don't like their tone, please let us know and I will review it personally.
Thanks so much, Dr. Wilensky. So just a quick reminder, we really do encourage some questions coming in via chat, or you may take yourself off mute. And Dr. Au Yeung, any final comments to add?
No, I think that don't have anything else to add.
Great. Well, I mean, I've given a lot of presentations on this, and so I know what primary care providers want to ask. Here's a question. Would you say that a face-to-face referral with an e-consult attached expedites or helps to expedite a face-to-face visit with a specialist? Typically, it wouldn't, but there might be scenarios in which it would. Let's say you're using an e-consult from an organization that you usually use for your face-to-face e-consults, and then they say, just tell them that Dr. Au Yeung sent you or something like that, in which case you might be able to work something out. Aside from that, I would say, if let's say there's an urgency that's been indicated by the e-consult, I would say, e-endocrinology feels that this person needs to be seen within several weeks. Please create an urgency here, and hopefully that will help. Whether it does or not, I don't know, but there could be situations where it would put you at the top of the line, but that would be something you'd have to kind of work out independently. That doesn't come through ConferMED, unless we have a specialty network and a primary care network that want us to be their middleman. Then we could work that out. And so the two big questions that I get, are number one, what about the medical legal aspects? When I send to a specialist, they are responsible, so I'm not going to get sued. And so what happens with this? And that's a very important question. You should all be aware of it, that you as the primary care providers maintain the patient-provider relationship and that the specialist does not have one. However, I always push back on the idea that once you place a referral, that it's off your plate and you don't have medical legal risks, because a lot of our patients no-show, a lot of the referrals take 3 months. If you say you've got chest pain, see a cardiologist, guess what? You're not done, because if they have a heart attack in a week and they haven't seen the cardiologist, it's on you. It opens up some medical legal risk to you, but it actually closes off some medical legal risk in that you've got this second set of eyes saying, oh my gosh, this is an emergency. And we get these every week or every 2 weeks. We have one of our specialists call us and this person I think needs to go to the emergency room. And then we have an emergency process where we get in touch with the organization right away and get that person seen urgently. And then I guess the second question that we always get is, how am I going to do this? It takes me 2 seconds to write GI consult, but I have to pay a lot of attention to sending off this e-consult. And then when it comes back, I got to do all these things. And that is hard for me to answer, because that is true. You will be working harder in a lot of ways, at least in the short term. You will have some things that you will need to do. But you'll be able to develop better rapport with the patient. You'll be able to have more to do with you in the next visit. You will also help the patient a whole lot more. And if the patient doesn't follow up with that face-to-face specialist, then they come back 3 months later and their problems are vastly worse and they're still on your plate. And then they become your emergency, right? So this is a way of keeping things from getting emergent. And although it might be more work for you in the short term, it's better for your patients, and it may just prevent work in the long term by preventing, crisis. And you concur. Very nice.
Well, I'm a gastroenterologist, so, I'm not taking care of cardiac disease, but if we do offer something like H. pylori or celiac testing and you can get those done, that actually saves the patient quite a bit over 3 to 6 months that they might wait on us. You're right about the no-show, that we have a high no-show rates, probably all the things you mentioned before that affect access, like transportation and time off work. Or maybe the child is better for a little while, so people kind of put it on the back burner when food on the plate is more important for that moment. I've seen IBD get missed for 6 months, even going into the ER, and they send them out and they don't make it to us. So I think I 100% agree that in the end, and it probably saves a lot of ER visits, that in the end, it will help. I don't know, but I think in our system, so many patients come to us anyway, and almost all of them do come to us at some point, that we can, if there's something emergent, we can respond that way and probably even find a way to reach the primary care who sent it to us and let them know to get them to us quicker.
Thanks to you both for these really vivid examples of how this all plays out and just where it falls within your workflow, and just with the candid feedback on the, the work that is required by primary care. And I know so many of you work with Medi-Cal patients, those of you who are on the call today. We started out this effort in the Central Valley with Fresno County, and it grew across Kings, Madera, Tulare, Inyo. Valley Children's is a leader in really supporting this effort across building eConsult across the Central Valley. And now we know that managed care plans support this across the state, and we're so helpful, or so thank you for that help. Thankful for that help, and just really glad to see this growing. We know that it does take time and effort. So with that, we hope to be able to provide some resources. This CME is one of those resources, ongoing educational opportunities, technical assistance, just opportunities to network with other providers that are doing this work. Dr. Au Yeung and Randy, thank you for providing this opportunity to have this conversation. If you are not in the Central Valley, if you're other places in California, if you're across the country, we do encourage you to have those local conversations. If you are a primary care provider, get your referral partner specialists to talk about how you might be able to do consults together. There are many different ways, as Dr. Wilensky and Dr. Au Yeung mentioned. Trying to make this work within your EHR and your workflow is so important. We do have coalitions across California, and we do eConsult work group efforts across the country. So if you do need help connecting, we're happy to help with that. And just last, we hope that if you're a primary care provider, if you're within a clinic, we hope that you'll encourage your providers to think of this as a potential first step to the routine non-urgent referral request. And with that, just a few opportunities that are available over the next couple of months. There's another CME opportunity, educational opportunity. These are not just for providers, but anyone who's interested in learning about how eConsult works. Next week on the 26th, we have a similar session on eConsult for patients with multiple comorbidities. And in honor of May as Mental Health Awareness Month, on May 17th, we're having a session focused on eConsult and tools to address mental health needs post-pandemic. So you can see our email and our work group website links down in the bottom of this page here. And Lauren, thank you for putting the link to the CME survey. If you are a provider and you want to receive continuing medical education units, please do complete the survey that you see the link to right there. We'll make sure you get that by email if you're not able to do it right this minute. A couple of people have asked if we will be recording and posting this session. The answer is yes. We'll send out this recording to you all in case anyone would like to share it with their colleagues. CME is not available post-session. However, if they just like to take a look at and listen to the conversation, they're welcome to do so. And with that, just a reminder to complete the survey. If you'd like to get credit, that link is in your chat. And thank you so much, Dr. Au Yeung, for your time today. We know you see patients, and taking time off away to talk about eConsult is really, really, really appreciated. Thank you too to Dr. Wilensky for really spearheading this work and giving great examples of how primary care providers and specialists can collaborate. If you had a chance, or if you needed to ask a question, didn't get a chance to ask it, you can share that with us and we'll make sure to get an answer back to you. And with that, thanks everyone for your time today. We'll leave the link up so everyone can get access to it, and have a great day.
Thank you.
Thank you, Libby.